Hospital and University of Ibadan. This time, a total of 1,042 candidates appeared for the examination, consisting of 1,019 medical and 33 dental graduates. 862 medical and 17 dental candidates passed, giving an overall pass rate of 83% for the medical and 51% for dental. This is the best result in the record of this examination. I congratulate the candidates and parents, guardians, as well as staff of the Medical and Dental Council. We appreciate the staff of the University College Hospital and University of Ibadan for providing the facilities and serene environment for a hitch-free examination. We appreciate the dedication and commitment of the examiners who worked diligently to organize a transparent and reliable examination, often working at extremely unsocial hours. We continue to move the examination to different zones of the country for equity, but it's expensive both for the candidates and council. We plan to have a structure at the premises of the council. This is a long-term plan and will be expensive for Mdcn to handle without special intervention fund. We planned to go on advocacy visit to the National Assembly to provide a special fund to be allocated to execute the project. We will appeal to other organizations like NMPC and CBN to assist. I wish to acknowledge the support we continue to receive from our parent ministry in the conduct of this examination. The ministers, the permanent secretary, and directors had given us unlimited support. On this occasion, we are not presenting any medical elder or guest speaker because of the time constraint to comply with the COVID-19 protocol. I wish to welcome the inductees to the noble profession. They should dedicate their time and energy during the period of housemanship, which is the foundation of their professional career. The Ministry of Health had approved the Federal Executive Council decision for central internship coordinated by Mdcn. The Central Hub Mission has started this January 2021. Candidates who qualified in medicine and dentistry are advised to log on the Mdcn website for guidance based on the vacancies existing in all federal hospitals. Once they report to the hospital, their details are transmitted to Mdcn, which endorses the list for payment by Accountant General of the Federation. There are initial hitches in the beginning of the program between hospitals and Mdcn. This has since been sorted out, and payment of salaries of health officers is now without hitches. There are no outstanding payment up to the end of July 2021. Council will constitute a monitoring committee consisting of the Nigerian Medical Association, Committee of CMDs, Ministry of Health, and Mdcn to address difficulties related to posting and rejection of health officers by some hospitals. I wish to assure the Honorable Minister, parents and guardians that your placement for housemanship will be smooth as long as you do not insist on specific hospitals. I wish to emphasize that CMDs that no candidate should be rejected on posting without referring to Mdcn. From January to date, Mdcn was able to accredit more than 30 hospitals, increasing the carrying quotas of institutions for housemanship. We appeal to state governments to improve the facilities in at least one hospital per senatorial district. This will increase the number of places for housemanship and reduce the internal brain drain to federal hospitals. Few states have started, specifically Lagos, Katsina, and Ogun. Distinguished ladies and gentlemen, I wish all of you a safe journey home. Thank you very much.
Thank you very much. The chairman, both of this occasion of the council. May I inform you all that you are being inducted at this auditorium, which also serves, interestingly, as the venue for the sitting of the Medical Disciplinary Tribunal. You are here inducted today, and I would like to encourage you to please go through the documents that you have been given so that you can abide by the ethics of the profession in all your conducts as a medical practitioner in Nigeria, that you may not appear this time at the tribunal being asked questions. Distinguished inductees for today, I'm to inform you that the oath form that you've all been given are to be filled as soon as possible, promptly, with your folio number written boldly on these forms, as very soon the officials of the Medical and Dental Council of Nigeria will be going around to retrieve these forms. I'm also happy to announce that this event is being streamed live, and the link for streaming, I'm sure you all have, but will still be displayed so you can share with your family, friends, and loved ones. These are part of the benefits, if I may say, of COVID-19 pandemic, as I'm sure before now we do not have this privilege of watching inductions live. Will I say I envy you somewhat? Maybe. Distinguished ladies and gentlemen, it's my honor and privilege to invite to the microphone for his keynote address a man who, just like you all, returned to this country after obtaining degrees abroad to serve the good people of this country. And he's still serving the good people of this country as the Honorable Minister of Health, Federal Republic of Nigeria. Distinguished ladies and gentlemen, Dr. Osage Ehanire to the microphone for his keynote address.
The Chair of the Board of Trustees of the Medical and Dental Council of Nigeria, the Registrar of the Council, proud parents, members of faculty, and all other ladies and gentlemen who have made today possible, directors, Federal Ministry of Health and of government here present, and above all, the young inductees of today, doctors who are beginning their career. It is my pleasure to be here at this important occasion, this induction ceremony for foreign-trained medical and dental graduates who were successful at the June 2021 assessment examinations organized by Mdcn, held at University College Hospital, Ibadan. I welcome you all, especially my young colleagues, to this auspicious occasion. I shall first congratulate you all, the inductees, on your success in the assessment examination, strongly believing it is to be the result of your diligence and commitment to studies. I welcome you to the noble profession of medicine and felicitate also with the parents and guardians who are here present and all those who are watching from home or from elsewhere for seeing the fruit of your investment in the education of your children and wards who you have supported to actualize their dreams. I acknowledge the effort of the chairman, Professor Hassan, the registrar, Dr. Sanusi, and staff of Mdcn, JAM, and UCH examiners, and also external examiners, and all stakeholders in the successful conduct of this examination a couple of months ago, which has produced this new addition to the health workforce in Nigeria. Mdcn has consistently regulated the practice of medicine, dentistry, and also alternative medicine in a manner that safeguards the best healthcare delivery for Nigerians. In pursuit of the President Muhammadu Buhari's mandate for all sectors of governance in the roadmap to key into the next level agenda, which is titled Delivering on the Government's Priorities 2019 to 2023, which provides a strategic direction for the executive to be responsible for delivering on their respective sectors. The health sector is charged with the priority area of human capital development, particularly, and also with the Ministry of Education. The health sector is a cornerstone of developing human capital to improve health and outcomes among all the deliverables. Pursuant to this, the federal government unveiled 9 deliverable priorities in the health sector for the second tenure of this administration, and they include the following: mandatory and universal health insurance in collaboration with state governments and the FCT administration, the operationalization of the Basic Healthcare Provision Fund in collaboration with relevant agencies and partners, recruitment and deployment of community health extension workers, revamping federal teaching hospitals across the country, collaborating with the private sector investors to establish high-quality hospitals in Nigeria, reducing gaps in all health-related sustainable development goals by at least 60%, reducing current imbalance between primary, secondary, and tertiary health care, actively collaborating with the private sector to create a large number of well-paying jobs for Nigerian youths, and implementing a strategy towards the realization of Mr. President's June 12 promise to lift 100 million Nigerians out of poverty in the next 10 years, and also soliciting increased investment in the health sector. The federal government envisions universal health coverage, making it accessible and affordable to all Nigerians, irrespective of social status. We are working very hard on that and on other deliveries in Nigeria. And today's induction is significant in that 879 practitioners will be added to the group of medical personnel that are already working to actualize this vision. This is particularly significant for the health sector because of concerns about manpower emigration that has bothered us for some time. So I congratulate you all and thank you all who have studied abroad and then returned to your fatherland. I encourage my colleagues, new and old, to redouble their efforts towards delivering our responsibility to deliver government's priorities in the health sector. I want to remind all the inductees that today is the beginning of a new phase in your lives. Your professional lives begin today. Medical and dental professions require continuous training and learning because it is constantly evolving, like all of science. New knowledge is constantly being added to old, and acquiring and increasing knowledge and skills is a lifelong endeavor in your profession. I will add that you will need to learn from your seniors, from your mates, your peers, and even from your junior colleagues. Knowledge does not have end, and for those who know, who have wisdom, you know that there's something to learn from every person. You know also that you cannot go further. You must also know that when you cannot go further, you need to ask for a second opinion, or when you must refer your patient to another doctor. This is what makes you a better professional. You are dealing with human lives, and they're the most precious things that you have. The best doctor is one who knows and accepts his or her limitation while struggling and working hard to continue to improve and reduce those limitations. In the course of your practice, you will face temptations, but you must resist them. There are a lot of things that are complained about in our country. Issuing fake sick certificates to people who are even healthy, or misdemeanors like even issuing death certificate for people who are alive. Those are issues which you should never be found to be involved in. I have no doubt in my mind that your experience since your return from foreign studies at some of the teaching hospitals and medical centers in Nigeria, where you have received some form of clinical exposure, particularly in tropical diseases, have added to your skills and knowledge and have made you more confident in yourselves to practice this profession. In the same vein, the Mdcn is discussing with teaching hospitals in all geopolitical zones to create the opportunity to further equip and increase the skills and knowledge of returning medical and dental graduates from overseas before they participate in this assessment examination. I also wish to use the opportunity to advise parents and also those who wish to study medicine or send their wards to study medicine at home or abroad, to ensure that the schools are accredited institutions. You can check that on Mdcn website, or the International Medical Education Directory, or the World Directory of Medical Schools. This is important because I can tell you that there are many schools springing up everywhere, purported to be teaching medicine, where it's become a business, high fees are charged, and little knowledge is given. I want to thank all the teachers, both home and abroad, for the work they have done in making you proud graduates and inductees today. I also want to call on consultants and senior medical officers under whom these new doctors will complete the last part of their training for 12 months to continue to commit themselves to the principles of hard work, diligence, and excellence, which are the hallmarks of medical profession, and to ensure that these new practitioners are well-trained and fit to obtain their full registration certificates. Federal Ministry of Health and the Budget Office of the Federation have approved in this year's budget funds for payment of house officers by Mdcn effective from January 2021. Mdcn is now charged with the posting, placement, and payment of House officers to ensure equitable availability of spaces for housemanship training on a first-come, first-served basis. I want to request all those who are involved with managing this program to ensure that complete and honest data are supplied and exchanged. As I congratulate you all again and your parents, I want to tell you that the sky is your limit. As has been said to you just now, I myself am foreign trained. I attended the LMU, Ludwig Maximilian University of Munich. You can Google it up, LMU Munich, founded in the year 1472. And I had to study altogether A to Z in a foreign language. What it tells you is that if you study in those countries, there are good opportunities. Not only to come back with a degree, but to have expanded your life about the world, about other people, other cultures, other practices, and to know that God's world is bigger and God must be respected and feared. On a personal note, I want to congratulate my nephew, who is among you. Dr. Lanrick, please stand up. Where is he? Okay, there he is at the corner. Congratulations. Dr. Larry Balogu is my nephew. And all the rest of you, your congratulations to you, no less, at the beginning of your career. I thank you all for your listening attention. God bless you. God bless your profession. And God bless the Federal Republic of Nigeria.
I would think that the Honorable Minister of Health deserves a louder round of applause. Some of us, we were not that privileged to have the Honorable Minister address us personally on our induction. Larry, congratulations. And all the other Larrys here. I think he deserves a louder round of applause to us. And I'm also proud to let you know that we have with us, joining us, one of our flag bearers, our flag bearers at the National Assembly. At the upper chamber, the red chamber, we have, well, he was actually originally elected by the good people of Kwara State to represent him. But by the time he got to the National Assembly, and being a medical practitioner and serving as the chairman, Senate Committee on Health, we adopted him as our ambassador, and he's been diligently carrying out his duties, both to his constituents and to his constituency. You can figure out the difference between the two. Distinguished ladies and gentlemen, please put your hands together for Senator Ibrahim Yahaya Oluriegbe, the Chairman, Senate Committee. Thank you very much. And he's here with the man you can call his twin brother. I'm always glad to see him attend medical events despite his very tight and busy schedule. I'm always proud to have him and to say I know him. Quite humble in spite of all his achievements. I once ran into him at the airport and he was quite friendly and warm to me. I bought food that day. He hasn't paid for the food yet, and I'm sure in due time he will do the needful, sir. Distinguished ladies and gentlemen, here is a man who served the association as the chief scribe of the Nigerian Medical Association, the Secretary General of the Nigerian Medical Association. We then sent him to the National Assembly, to the House of Representatives, and he's been representing us quite diligently. And one of these is exemplified by his presence here today, as he's been present at many other induction ceremonies that I've also witnessed. Distinguished ladies and gentlemen, Honorable Dr. Tanko Yusuf Sununu. He's the chairman, House Committee on House of Representatives. It's plenty. Thank you. Distinguished ladies and gentlemen, and so on that note, while without necessarily preventing the Chairman Senate Committee on Health to catch his breath, we'll be glad to have his goodwill message. And so it's my honor and privilege to invite him to the microphone. Distinguished ladies and gentlemen, Senator Dr. Ibrahim Yahaya Oluriegbe.
The Chairman, House Committee on Health Services, my brother and colleague, Honorable Dr. Yusuf Tanko Sununu, the Honorable Minister of Health, my colleague and brother as well, Dr. Sagio Ehanire, the Chairman, Medical and Dental Council of Nigeria, our elder brother and elder senior colleagues, the Registrar of Medical and Dental Council, and I can see the Chairman of National Postgraduate Medical College, as well as my brother, Dr. Merubole, who is a permanent secretary in the Office of Head of Service. I can see many past presidents of NMA and very senior medical practitioners, and the owners of today, the graduates, parents, guardians, distinguished ladies and gentlemen. It's my pleasure to be here this morning to felicitate with the parents and guardians as well as the graduates of today. Let me join the previous speaker to congratulate the parents and the new doctors who will be receiving their preliminary approval for their licenses today after being inducted into the noble profession of medicine. I also congratulate the Mdcn for organizing a successful examination, which we are privileged to participate in Ibadan. And to say that as National Assembly will continue to provide necessary support to Mdcn to make the examination easy. We took a decision in Ibadan during this last examination that Mdcn itself should provide in-house facility to conduct the examination and not depend on external partners. As National Assemblies, we see, working with the executive, that necessary provisions in terms of funding is provided for this to be achieved. Let me use this opportunity to also pass message to our new and young colleagues that this profession is a noble profession and you are being called to serve humanity. As is often said, medicine is the first and I would say the last profession. It's the first profession because for us as human beings, many human beings, if you have to come into the world, you'll be attended to by a midwife or probably even by a doctor, but whoever that is attended to the woman that is about to deliver is providing health services, is practicing medicine. And of course, most people when they die, they want to die. It is usually through one thing or the other. But even if you die natural cause, most times you still end up in hospital either for embalmment or so on before you are buried. It means between the beginning and the end of human life, medicine has major role to play. And as is often said in many cultures, in Africa especially, people said after God, it is doctor. So therefore, we must know as doctors that we have huge responsibility to humanity and to our Creator. The confidentiality of our profession or of our clients is very important. The dedication to work is also very important, because one of the professions where Nigeria is a religious state, where by practicing it, you earn a reward from your God. And we should hold this as very, very important as we pass through the journey of life. I want us to be able to believe that by being in this profession, we have chosen to serve, and service should be uppermost in our mind. And this should be what should be our guiding principle. So on that note, since we are, despite the joy of today, it's unfortunate that we have some of our colleagues who are not working now in hospitals. And through this, a lot of our citizens are suffering. We use this opportunity to call on the resident doctors to go back to work and serve humanities that we have also sworn to serve. Whatever are the issues at stake is being handled by those of us who are placed the responsibility to ensure that their payments are made and the processes is on. The discussion we had last week was to that effect. I want to join millions of Nigerians to be able to call on them to go back to work. Just like I'm charging the new doctors, I'm charging everybody who is a doctor to hold that charge of service to humanity as one. Finally, once again, I congratulate all the graduates of today and wish you the best in life. God bless the Federal Republic of Nigeria.
Thank you very much. And just to let you know that there are no color codes at the National Assembly. So today has not been selected as the day for blue color. But sharing the same color code with his brother, the chairman, all right, I'm glad to announce that the Honorable Minister of Health would like to take his leave and to attend to other matters of national importance. Distinguished ladies and gentlemen, may we please rise as the Honorable Minister of Health exits. Thank you very much for coming, sir. The Honorable Minister is saying congratulations. Thank you very much. So on this note, I would like to invite to the microphone for his goodwill message, the chairman, House of Representatives Committee on Health Services, Honorable Dr. Yusuf Tanko Sununu.
The chairman, Senate Committee on Health, my elder brother, distinguished Senator Ibrahim Yahya Olorogbe, the Permanent Secretary in the Office of the Head of Service, Special Duties, my mentor lecturer, the Chairman of Medical and Dental Council of Nigeria, Professor Abba Hassan Waziri, the Registrar of the Council, the President of National Postgraduate College of Nigeria, Professor Brodo, the Provost of College of Medical Sciences and Health Sciences here, President, Top Management Committee of Medical and Dental Council of Nigeria, the inductees, parents, guardians, ladies and gentlemen of the press, good morning. Today is yet another day of happiness, because if one look at the challenges of manpower, especially for human resource for health in Nigeria, we'll be very glad to witness a situation whereby young colleagues will be inducted to join the profession. I therefore want to use this opportunity to congratulate the parent, most especially, I always start with the parent, because if you had sit down and take a stock of what your parents have so far invested to where we are today, I think your parents generally and our parents deserve a round of applause for all of us. Thank you very much. Now, coming to the doctors that are to join the profession. This profession is an ethic-based profession, and you must go back and look at the ethics so that you can work within the ambit of law. One of the most important principles of ethics is autonomy. Patients can never be treated as inanimate objects. Patients have rights, and that right must be respected by every practitioner. They have the right to be informed so that whatever consent they are going to give must be based on informed decision. And you can only give an informed consent when you to yourself is well knowledgeable about what you are going to counsel your patient on. It means, therefore, as from today, what you have done is just a child's play. You must begin to expand your knowledge and skill henceforth so that you can be able to guide your patient. You must also know that as part of medical ethics, there is requirement for justice. And in justice, patient must be treated with equality. You can show equity in terms of surgical triage where you have some medical cases where you need to, based on the emergency of patient, but because of class of patient, you shouldn't differentiate anybody that you are going to give care to. Patient must be treated equally, and most importantly, you must not do harm. Lack of doing harm is very important. As house officers, you are the first point of call. It is harm to the patient for you not to call immediately the attention of your senior colleague. Don't assume it's an emergency, you have treated it before, you cannot call anybody, you quickly do and no. Call your immediate person. You must shout for help in this settlement. In so many places that require your attention, so you must not do harm. It's also doing harm for you to exceed your level of competence in treating patients. Don't go outside privately and continue to think. If we are to do that, definitely we are decent. And then finally, away from ethics. If you have joined the profession, the employment so far is very difficult except if you are health-related distance. And I will advise you as you are doing your housemanship, as much as possible, please try to start reading in terms of patient care as it is. Don't just be contented with Bachelor of Medicine and Bachelor of Surgery. In some climates, especially where you train, you have professors of nail surgery, you have professors of earlobe surgeries. So the world is going into sub specialties. So let us endeavor to add to our skill. And I wish you a happy stay in the medical profession. We do hope that one day we will be here at the MDCM to celebrate you. You have attained the 70th age of golden age where you are no more required to pay your annual dues. And therefore you must be able to register always, each and every year. Registration is not MCC's responsibility. It's every doctor's responsibility, and you must know that. You are to take yourself to MDCM, pay according to the law, so that you will not be found wanting. Practice without being registered for your licenses is illegal in Nigeria and is punishable by this. We must commend the MDCN for the new blood it has injected now. In the last 2 years, MDCN Tribunal has been sitting several times, and we have seen those who are following the news. You have to follow so that you can get yourself protected. For MDCN, ignorance is not an excuse. You'll be prosecuted. Please, let's take a lesson from there. Thank you very much for the opportunity.
Thank you very much. An interesting part of today to do. No matter what else you choose to become, you're already a medical doctor. Honorable Dr. Tanko Yusuf Sununu He's a distinguished consultant obstetrician and gynecologist, and I cannot tell you that in spite of his being in the House of Representatives, he still conducts cesarean sections free for his constituents, and I think for that alone, he deserves a very loud round of applause for him. We have some proud parents here with us, and we want to congratulate you all for witnessing this occasion. One of these is His Excellency, the Deputy Governor of Jigawa State, Alhaji Umar Namadi. You're welcome, sir. Okay, you may please proceed to the high table, sir. Ushers, please. Thank you very much. As soon as I have other lists, I'll kindly do recognize the presence. On this note, may I respectfully invite to the microphone for the moment we've all been waiting for. I'll be inviting to the microphone a man who it appears that on the day of his naming ceremony, he's been destined to be in charge of the everyday affairs of medical and dental practice in Nigeria. How else do you explain that the first letters of these man's names are tabs? And we all know that our prescriptions usually carry the acronym TABS when we refer to tablets. Distinguished ladies and gentlemen, he assumed his office, the role of the Registrar and Chief Executive of the Medical and Dental Council of Nigeria, and executed a turnaround of the practice. You will not know how much struggle has been eliminated when you get posted for housemanship. In our days, struggling for house job was indeed a war. The easiest way for you is to be congenital, as we call it. That is, your parents are medical professionals in your choice teaching hospital. Today, the conduct of assessment examination is as transparent as the letters in the word transparent can be. You're rewarded for your hard work, and if you do not work hard, you will also be rewarded accordingly. This man and myself and you all inductees have something in common. We were all assessed and satisfied examiners at the prestigious University College Hospital, Ibadan. Please put your hands together for yourselves for that. A distinguished dental practitioner, well-read in the aspects of medical jurisprudence. Please put your hands together as a welcome to the microphone. The Registrar and Chief Executive Officer, Secretary to the Council of Medical and Dental Council of Nigeria, Dr. Tab Sanusi.
Thank you very much. The chairman of this occasion, who is no other person than our own amiable chairman, Professor Abba Hassan Waziri Mubi, the chairman, Senate Committee on Health, Senator Ibrahim Olori-Egbe, the chairman, House Committee on Healthcare Services, Honorable Dr. Tanko Yusuf Sununu, council members present here, His Excellency, the Deputy Governor of Jigawa State, one of our own, the Permanent Secretary in the Office of the Head of Civil Service, Dr. Emmanuel Meribole, the management staff present, proud parents and guardians, the inductees, gentlemen of the press, distinguished ladies and gentlemen. I seize this opportunity to welcome all of you to this grand occasion, the occasion of induction of the candidates that were successful in the assessment examination held at the University College Hospital, Ibadan. Today's ceremony is a solemn ceremony, a call to service, and that service is service to humanity. As doctors, you are the heads of the medical team. But the headship must be earned. If I say earned, if you are supposed to be in the clinic by 8 o'clock, you are there. If you are not there, you are already losing grip. We will advise that from today on, after your induction, your attitude must change. Without wasting much of our time, I want to seek for the permission of the chairman to just say a few things about disciplinary organs of council. The council has own inherent disciplinary organs, the investigating panel and the disciplinary tribunal. Panel conducts what we call preliminary investigation into alleged professional misconduct, and the panel sits in camera because nobody is on charge. If you have no case to answer, the matter ends there. If a prima facie case is established against you, the matter is transmitted to the tribunal. However, in exceptional cases, where panel feels you constitute danger to public health, you are suspended immediately. Of course, the trial is facilitated. Coming to the tribunal has the same status with the High Court. Of course, at the level of tribunal, the rules of evidence is relaxed. And the trial goes on there. At the end of the trial, it's either you are discharged and acquitted, or admonished, suspended, or your name struck off from the relevant register. This is to sensitize you that coming to this profession is not a tea party. It's a call to service, and that service is service to humanity. You will recall that presently the resident doctors are on strike. As house officers, we don't expect you to join because you have a structured program which is uninterrupted. And by council policy, you are not members. However, if you elect to be members, you are free, but it must not affect your posting because you are expected to go through 12 uninterrupted weeks of posting in each of the specialties, as the case may be in medicine or dentistry. Over the years, getting placement for the housemanship has been a problem. But we thank God, since the beginning of this year, when the centralized issue has been actualized, it has become a thing of the past. Yes, you might experience a delay. The delay will be by way of choice of place or places you want to do your housemanship. And the web portal is so structured in such a way that you pick 3 places If there are no vacancies in any of the 3 places, the system will bring up all the hospitals where there are vacancies for you to pick one. Once you pick one, you get your letter of appointment, a copy in your mailbox, a copy to MDCN, and a copy will go to the institution. Please note that under no condition must you write back and say you have resigned. If you resign, even if you spend 7 months, you have to return all the fees, all the salaries you have taken. We need to instill discipline. It's not a joke. The fund is not there. And for the federal government to be so magnanimous to have actually put some funds together for this training, we won't mess it up. Think properly, make sure you are lucid when you are picking wherever you want to go. Be sure of where you are going. We are not entertaining any form of resignation. By the time you are resigning, just make sure you get all the money you have been paid. Then you have to pay back to the federal government. Then you can go to wherever you want to go. That is the rule. And I think you people should understand it. Nobody posts anybody here, so there's no issue of preferential posting. But you need to be told that for now, there are no spaces in Abuja. That is the situation as per our portal. Having said that, with the kind permission of the chair of this occasion, may I request all the inductees to please stand up. I can hear you murmuring. That is the statement of fact. It's either you are in or you are not in. Because the posting must be 12 uninterrupted months of 12 weeks in each of the postings. You raise your right hand up and say after me, please don't let me see you doing something else. I can identify you people. This is a serious profession. People coming before you, they are sick. But in most cases, it is the pain that normally brings the patient before you. And by the time they are before you, they are already vulnerable. That is why we expect you to be very compassionate when you are dealing with your patient. If I say, I, doctor, you mention your names, and you say the rest after me. So we'll start. I, doctor, do sincerely and solemnly declare that as a registered medical or dental practitioner of Nigeria, I shall exercise the several parts of my profession to the best of my knowledge and ability for the good, safety, and welfare of all persons committing themselves to my care and attention, and that I will faithfully obey the rules and regulations of Medical and Dental Council of Nigeria and all other laws that are made for the control of the medical and dental professions in Nigeria. I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, and social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will practice my profession with conscience and dignity, and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I made these promises solemnly, freely, and upon my honor. So help me God. You are welcome to the profession.
Thank you. You may please be seated. I thought you would put your hands together for yourselves. Whether you choose to continue as a medical practitioner or you choose to become a musician like Dr. Sid or an actress like Kiki Omili or a broadcaster like Hamid Adediran or a politician like Dr. Sununu and Oloriegbe, you are a doctor. Your parents, friends, and families might have been calling you doctor since you were born. Today is when you rightfully own that title, and for that, I think you deserve to appreciate yourselves again. One of the proud parents here, who has been very much here with us, I must sincerely apologize for not recognizing her presence before now, and I hope my apology is granted because I frequent Ogun State within her jurisdiction as a High Court judge, and I just hope that I will not be one day commanded and remanded in one of those dreaded prisons in Ogun State. Distinguished ladies and gentlemen, please welcome with me Honorable Justice A. Rotimi Balogun from the High Court of Justice in Ogun State, a proud parent of today. Permit me to also quickly recognize the council members here present with the kind permission of the chairman of the council. Recognize the presence of the council members here present. The Director of Medical Services in Yobe State, Dr. G.M. Fika. A round of applause. Provost, College of Health Sciences, Usman Dafodio University, Sokoto, Professor S.A. Saidu. Director of Medical Services, Ebonyi State, Dr. Gabriel Onwe. Director, Medical Services, River State, Dr. Manda Chijioke Oke. Director of Medical Services, Jigawa State, Dr. Abbas Yau Garba. Past President of the Nigerian Medical Association and member representing the Nigerian Medical Association, Dr. Idris Omede. A round of applause for him. Council member from Ogun State, Dr. Yusuf Kudus Adegwega. Oh, good to see you. Council member representing Edo State, Dr. Mrs. Sebore Helen Izoge. Council member representing the Nigerian Dental Association, Dr. Tokwe Emmanuel Adeyemi. Council member representing Taraba State, Dr. Ahmed Kara. And of course, my teacher and big brother, Dr. Imran Oludare Mohasin Bello. Also, the members of the senior management team, we have with us Dr. Victor Gbero, Deputy Registrar and Head, Department of Planning, Research and Statistics and Inspectorate. Dr. Nemeka Wakama, Deputy Registrar, Head, Medical Education. Dr. Enejo Danjuma Abdul, Assistant Registrar and Head, Professional Discipline. Dr. Henry Okukonye, Head of Registration Department. Mr. Abdulganiyu Oladokun, Head, Department of Admin and Human Resources. Mrs. Sakinat Mustafa, Head, Department of Finance and Accounts. Barrister YB Shaba, Head, Legal. Distinguished ladies and gentlemen, I'd like to hand over the microphone now for the affirmation of the pledge. Your certificates will be presented to you subsequently, but to do that, I'd like to invite to the microphone the Head of Registration Department. And may I remind you all to please fill your oath forms and get them ready for retrieval. Dr. Henry Okukonye, please.
Thank you very much. Thank you very much. Our highly valued chairman of this occasion and the chairman of the Medical Advisory Council of Nigeria, Professor Abba Hassan OON, a gentle bulldozer and a very wonderful achiever. You will permit me, sir, to stand on the already well-established protocol. It gives me a great pleasure to be called upon to take the affirmation of the pledge you have just made. This pledge actually is in 3 sessions, and when the registrar was speaking, he told you about 2 organs of council which are created by law. One of them, the presiding panel, and the second one, the tribunal. What you have said by the pledge you have made and by this affirmation is, if I'm found wanting in the course of my practice, please sanction me. That's what they're saying by this pledge. And I want to be sure that you say that after him. You raise up your hand in the name of whatever you believe to affirm it, and that you reduce it to the form you are going to fill, and you will sign in your with your handwriting. That oath form or the pledge form, as the case may be, will be put in your file. You will be surprised. The next day you will see it is the day you are before the tribunal or the panel. So you have agreed that whenever you are found wanting, cases of negligence or malpractice, that you should be disciplined. So you still have a privilege now, if you don't want to be under any of these laws of Nigeria or medical practice or Mdcn, to opt out, to refuse to take the affirmation. If you are here, you can raise up your hand to say, I don't want to continue again. Anybody raise up his hand? Okay, you may rise to your feet now, everybody. Our usual practice is to put a Quran and a Bible that you will come and file out one by one, put your hand on anyone that you believe in, and affirm, make the affirmation. But in this era of COVID, that will not allow for obedience of the COVID protocols. Therefore, I know that every one of us here believes in something. And we
are going to touch an imaginary Bible or a Quran with our heart. You will connect to that Bible and make sure you are touching it with your heart and make the affirmation. So I'd like you to lift one hand up to God, because God is watching you, is a witness. And the next hand to your heart. That is the way the Bible or the Quran or whatever you believe in is. And as you have done before, you are going to say very loudly and clearly after me. When I say go, you say I. You will not mention your names. When you are taking the pledge, your names didn't come out clearly. Make sure your name comes out very clearly, please. So we go. I, Dr. hereby affirm to the pledge I've just made. So help me God. Thank you very much. Congratulations.
Congratulations once again and welcome into the medical and dental profession in Nigeria. On this note, we're gradually coming to the end of this batch of the event. And at this point, I would like to request you all to please stand. This first assignment as a medical and dental practitioner in Nigeria, as a medical doctor in Nigeria, is for you to give honor to whom honor is due. This honor will come in the form of a bow.